Where are we going with it? It's an interesting question. We certainly will follow the current trends that are going on, where it's becoming more and more ubiquitous in day-to-day practice. It's becoming more and more essential. There is an awareness that this is increasing quality and improving care. We heard some examples beforehand how it's improving the patient experience. So where was I going with this? What I would say is the future will almost certainly hold that no human will look at an imaging study, whether it's an EKG or an EEG or a medical imaging study from radiology before a computer has had a chance to look at it. And they may register the images between the old visit and the new visit so you get your most sensitive thing for change. Or it will already have highlighted things that it thinks are abnormal for you to see. Or as you heard earlier, it will do all the measurements so I can say this thing was 30 cc's in volume before, and though when you look at an image it isn't much change, but when you look at it in all three dimensions it's now 50 cc's. So what might have been no significant change now becomes, aha, I now detect this change early. So one of the aphorisms that you'll hear, and I think this is really sound, is that we will probably not open and look at an imaging study before a computer has seen it and has prepped it for us, has arranged it for us, is highlighted it for us, and then we can let human intuition and wisdom and experience finish the process.
Okay, anything to add?
Yeah, I agree with everything he said. And I also wanted to comment on, we talk about things that we use at RadNet, but hospitals use different AI products that are more geared towards urgent findings, and that's very important. That is going to keep growing. So for example, these AI apps that are out now can actually detect where the blood clot is in stroke patients. And studies have shown that the faster we can detect that and get the patient on a table for a clot retrieval device, it actually really does impact morbidity and mortality. It can save lives. Those kind of triage apps are just going to keep growing. We have apps that, again, detect spine fractures, apps that detect blood clots in the lung, pulmonary embolism, that detect brain bleeds. And these are all very important AI tools, But when it comes down to stroke, I mean, if every minute you go without blood flow to your brain, you lose 1.9 million brain cells. Wow. So you can see why it would be so important throw the AI tool on first, find where the clot is, and get the patient treated to save as much brain tissue as we can.